Did you know that your liver plays a crucial role in detoxifying your body, helping with digestion, and producing important substances? Unfortunately, certain factors can cause damage to your liver, which can negatively impact your overall health. It's important to be able to recognize the signs of liver damage. In this video, we'll talk about the common signs to look out for. Make sure to watch until the end, as we'll also discuss several steps you can take to properly care for your liver and reduce the risk of liver damage. Number 1. Fatigue and weakness. Liver damage can lead to persistent fatigue and weakness. The liver, being responsible for removing toxins and waste products, plays a crucial role. When it isn't functioning properly, the body can feel overwhelmed, resulting in fatigue and weakness taking center stage. Fatigue can bring about feelings of extreme tiredness, decreased energy levels, and reduced alertness. Unfortunately, this can impact your ability to carry out daily tasks and significantly affect your overall quality of life. It's worth noting that fatigue alone can be caused by a range of conditions. Number 2. Jaundice. Jaundice, a common sign of liver damage, is characterized by the yellow or brown discoloration of the skin and eyes. It is particularly prominent in cases of liver damage from alcohol consumption. The liver plays a crucial role in removing waste products from the body, including bilirubin, which is a yellow-colored pigment produced during the breakdown of red blood cells. When the liver is damaged, it fails to effectively eliminate bilirubin, leading to its accumulation in the bloodstream. As a result, the excess bilirubin causes the skin and eyes to take on the distinct yellowish hue associated with jaundice. It can also be a sign of various liver conditions, such as viral hepatitis, alcoholic liver disease, or liver cirrhosis. Number 3. Digestive issues. Liver damage can cause a range of digestive problems. The liver produces bile, a fluid that aids in the digestion of fats. When the liver is damaged, it may produce insufficient bile, leading to difficulties in digesting fatty foods. This can result in symptoms such as bloating, abdominal pain, diarrhea, and greasy or pale stools. Additionally, liver damage can affect the absorption of vital nutrients, further impacting digestive health. Before we proceed to the next surprising sign of liver damage, be sure to hit the subscribe button. Number 4. Abdominal pain and swelling. Liver damage can cause abdominal pain and swelling. The liver may become enlarged or inflamed due to conditions like liver disease or cirrhosis. The enlargement can exert pressure on the surrounding organs and tissues, causing discomfort or pain in the upper right quadrant of the abdomen. Swelling, known as ascites, can also occur when fluid accumulates in the abdominal cavity, leading to a feeling of fullness and distension. Number 5. Changes in urine. Another important sign to watch for is changes in urine. Normally, urine appears clear or light yellow, but if it turns dark or reddish, it suggests potential issues with liver function. This discoloration is often due to the presence of bilirubin, a waste product that the liver normally filters out. When the liver is not functioning properly, it may struggle to process and expel waste effectively, leading to the buildup of bilirubin in the urine. The presence of dark urine is commonly associated with cholestasis, a condition characterized by impaired bile production. Cholestasis is frequently observed in individuals with liver disease and should not be ignored. Seeking prompt medical attention is crucial in such cases to diagnose the underlying cause and initiate appropriate treatment. Number 6. Itchy skin. Pruritus or itchy skin can be another common sign of liver damage. It occurs when toxins such as bile salts build up in the bloodstream due to the liver's reduced ability to remove them. This buildup can lead to skin irritation and itching, which can be quite intense. Scratching the affected areas may provide temporary relief, but can also cause further skin damage or infection. Number 7. Weight loss. Unintentional weight loss is often observed in individuals with liver damage. This can be caused by various factors, including a decreased appetite, malabsorption of nutrients, metabolic changes, and the liver's compromised ability to store glycogen and produce essential proteins. As a result, significant weight loss can occur over time, even without trying to lose weight. Number 8. Mood swings and mental confusion. Liver damage can impact brain function and lead to mood swings and mental confusion. The liver helps in detoxifying harmful substances, including ammonia, which is a byproduct of protein metabolism. When the liver is damaged, ammonia can build up in the bloodstream and affect brain function. This can result in mood changes, irritability, difficulty concentrating, memory problems, and even more severe cases of hepatic encephalopathy, which may involve confusion, disorientation, and coma. Number 9. Easy bruising and bleeding. Liver damage can affect blood clotting, leading to easy bruising and bleeding. The liver produces clotting factors that are essential for the normal coagulation of blood. When the liver is damaged, the production of these clotting factors can be impaired, increasing the risk of bruising from minor bumps or injuries. Additionally, liver damage can reduce the production of platelets, which are involved in blood clotting, further contributing to a higher tendency for bleeding. Number 10. Spider angiomas and palmar arrhythmia. Spider angiomas are small, reddish arterioles that resemble spider legs. Palmar arrhythmia refers to the reddening of the palms of the hands. These skin changes can occur in individuals with chronic liver disease, particularly those with elevated estrogen levels. Liver damage can cause hormonal imbalances, leading to the dilation of small blood vessels, visible as spider angiomas, and increased blood flow to the palms, resulting in palmar arrhythmia. These dermatological signs can serve as indicators of underlying liver damage. Remember, if you experience any of these signs or symptoms of liver damage, it is important to consult a healthcare professional for proper evaluation, diagnosis, and treatment. They will be able to provide appropriate medical advice and individualized care based on your specific condition. How to properly care for your liver. A healthy liver is essential for overall health and well-being. Now, let's discuss several steps you can take to properly care for your liver and reduce the risk of damage or disease. Number 1. Limit alcohol consumption. Excessive alcohol use is a leading cause of liver damage and disease. For good liver health, limit your alcohol intake to no more than 1 drink per day for women and 2 per day for men. Abstaining from alcohol altogether is the healthiest choice for your liver. Number 2. Maintain a healthy weight. Being overweight or obese puts extra stress on your liver and can lead to non-alcoholic fatty liver disease. Losing weight through diet and exercise is one of the best ways to prevent and even reverse liver damage from excess fat accumulation. A balanced diet with lean proteins, lots of fruit and vegetables, whole grains, and limited red meat, full-fat dairy, and sweets is good for your liver and overall health. Number 3. Get vaccinated. Viral hepatitis is a common cause of liver inflammation and damage. Many people with hepatitis do not have symptoms and do not know they are infected. Symptoms of chronic viral hepatitis can take decades to develop. There are vaccines available for hepatitis A and B that can help prevent these infections and reduce your risk of serious liver damage. Number 4. Limit exposure to toxins. Exposure to environmental pollutants and industrial chemicals can damage the liver over time. Avoid or limit contact with toxic substances when possible. Use natural cleaning products and pesticides in your home. Be aware of the potential effects of medications and herbal supplements on your liver. Some medicines and supplements in high doses or when combined can be toxic to the liver. By following these preventive steps, you can keep your liver healthy and functioning properly. However, if you notice any signs of liver damage or disease, consult your doctor right away. They can determine if any diagnostic tests or treatments are needed and help you take further action to support your liver health.
Fatty liver disease, also known as hepatic steatosis, is a condition characterized by the accumulation of fat in the liver. This excess fat can cause inflammation and damage to the liver cells and lead to eventually liver failure if left untreated. This condition affects millions of people worldwide, and certain foods and drinks can make it worse. That's why it's important to know what drinks and foods to avoid and follow a healthy lifestyle to improve liver function and effectively manage fatty liver disease. In this video, we'll delve into some foods and drinks that are harmful for your liver. So without further ado, let's get started. Number 1. Sugary beverages. Sugary beverages such as soda, sweetened juices, and sports drinks contain high levels of added sugars, which can be harmful to individuals suffering from fatty liver disease. Their excessive consumption can lead to weight gain, further inflammation, and fat accumulation in the liver. According to the American Heart Association, added sugars account for more than 13% of adults' daily caloric intake in the United States. Additionally, research suggests that drinking 1 to 2 sugary drinks per day can increase the risk of developing fatty liver disease by up to 40%. Drinking sugary beverages also contributes to chronic conditions like obesity, type 2 diabetes, and cardiovascular disease, which are significant health risks to people with fatty liver disease. These increased risks underscore the importance of reducing or avoiding sugary drinks in your diet. Water, sparkling water, or unsweetened tea and coffee are excellent alternatives to sugary beverages. Natural fruit juice can also be consumed in moderation. Reducing the intake of sugary beverages can result in significant health improvements. Number 2. Alcohol. Alcohol can worsen fatty liver disease because it adds an extra burden on an already weakened liver. Fatty liver disease occurs when excess fat accumulates in liver cells, which can result from various factors such as obesity, diabetes, or excessive alcohol consumption. When you have fatty liver disease, your liver is already struggling to function properly due to the buildup of fat. By drinking alcohol, it further stresses the liver because it must metabolize the alcohol, which produces toxins and can lead to inflammation and further damage to liver cells. Moreover, excessive alcohol consumption can worsen liver conditions like alcoholic fatty liver disease, alcoholic hepatitis, or cirrhosis, which are characterized by inflammation, scarring, and impaired liver function. Therefore, for individuals with fatty liver disease, it's crucial to avoid or limit alcohol consumption to prevent further harm to the liver. Number 3. Processed foods. Processed foods are a major concern for individuals with fatty liver disease. These foods often contain high levels of unhealthy fats, added sugars, refined carbohydrates, and artificial additives. Regular consumption of processed foods can contribute to weight gain, insulin resistance, and liver inflammation. A study published in the Journal of Hepatology found a direct association between the consumption of highly processed foods and an increased risk of developing fatty liver disease. Processed foods such as fast food, packaged snacks, sugary cereals, and ready-to-eat meals often lack essential nutrients and fiber while being high in calories and unhealthy ingredients. One of the main culprits in processed foods is trans fat, which is commonly found in items like fried foods, commercial baked goods, and some kinds of margarine. Trans fat has been linked to liver inflammation and an increased risk of fatty liver disease progression. Moreover, excessive consumption of added sugars, commonly found in processed foods and beverages, can worsen liver health and contribute to the development of non-alcoholic fatty liver disease, NAFLD. To improve liver health and manage fatty liver disease, it is important to prioritize whole, unprocessed foods in your diet. Opt for fresh fruits and vegetables, lean proteins, whole grains, and healthy fats like those found in avocados, nuts, and seeds. By focusing on a balanced diet of whole foods, you can support your liver health, manage weight, and minimize the risk of fatty liver disease progression. Remember, it's not just about what you avoid, it's also about nourishing your body with wholesome, nutrient-dense foods. Number 4. Red meat. Red meat is commonly associated with a higher risk of several health conditions, including fatty liver disease. Red meat, such as beef, pork, and lamb, are high in saturated fats and cholesterol. These unhealthy fats increase the risk of developing fatty liver disease by promoting inflammation and fat accumulation in the liver. A study published in the World Journal of Gastroenterology found that high red meat consumption is associated with a higher prevalence of fatty liver disease. Researchers suggest that limiting red meat intake could potentially help manage and prevent the disease's progression. Individuals with fatty liver disease should consider reducing or eliminating red meat consumption or swapping it with lean protein sources. Moreover, red meat is often prepared in ways that further exacerbate its negative health effects, such as deep frying or grilling at high temperatures. These cooking methods increase unhealthy compounds that can contribute to inflammation and worsen liver health. It is recommended to choose healthier cooking methods like roasting, broiling, or grilling at low to medium temperatures. Instead of red meat, it is better to choose lean protein sources like chicken and fish, or plant-based sources like beans, lentils, and tofu. These sources contain healthy unsaturated fats, fiber, and essential nutrients needed for proper liver function. Furthermore, a diet rich in fruits, vegetables, whole grains, and healthy fats can help manage and prevent the progression of fatty liver disease. It is essential to consult with a healthcare professional and a certified dietitian to design a well-balanced meal plan that meets your specific needs and goals. Number 5. Fried foods. Fried foods can have detrimental effects on liver health, especially in the context of fatty liver disease. Regular consumption of fried foods such as French fries, fried chicken, and deep-fried snacks can contribute to weight gain and worsen liver inflammation. Studies have demonstrated a strong association between the consumption of fried foods and the development and progression of fatty liver disease. The deep frying process leads to the formation of harmful compounds, such as trans fats and advanced glycation end products, AGEs, which can promote inflammation and oxidative stress in the liver. Research published in the American Journal of Clinical Nutrition has shown that a high intake of fried foods is linked to an increased risk of liver disease and impaired liver function. Regular consumption of these foods can lead to excessive fat accumulation in the liver and worsen the condition. To improve liver health and manage fatty liver disease, it is crucial to minimize or eliminate fried foods from your diet. Instead, opt for healthier cooking methods such as baking, grilling, steaming, or sautéing with minimal oil. This can significantly reduce the intake of unhealthy fats while still providing enjoyable and flavorful meals. Emphasizing a diet rich in whole, unprocessed foods is key. Incorporate plenty of fruits, vegetables, lean proteins, whole grains, and healthy fats like avocados, nuts, and olive oil. These foods offer essential nutrients, antioxidants, and fiber that support liver health and overall well-being. Before we continue, don't forget to hit the subscribe button so you don't miss any more videos like this. Number 6. High-fat dairy products. High-fat dairy products like cheese, whole milk, butter, and cream contain high levels of saturated and trans fats, which are associated with an increased risk of fatty liver disease. According to a study published in the Journal of Hepatology, high saturated fat intake has been linked to a higher prevalence of non-alcoholic fatty liver disease, NAFLD, in both children and adults. The American Liver Foundation reports that NAFLD affects approximately 25% of Americans, making it one of the most common liver diseases in the United States. Consuming high amounts of saturated fats from dairy products can contribute to the development and progression of NAFLD. Research has shown that high-fat dairy consumption is associated with liver inflammation and insulin resistance. A study published in the Journal of Gastroenterology and Hepatology found that individuals who consumed the most high-fat dairy products had a significantly higher risk of NAFLD compared to those who consumed the least. However, it's important to note that not all dairy is detrimental to liver health. Low-fat versions of dairy products such as skim milk, low-fat yogurt, and reduced-fat cheese can be included as part of a balanced diet. These options provide essential nutrients like calcium and protein while minimizing the intake of unhealthy saturated and trans fats. Replacing high-fat dairy with healthier alternatives is a wise choice for managing fatty liver disease. For example, almond milk, soy milk, and other plant-based milk alternatives offer lower levels of saturated fats and can be used as substitutions in various recipes. Number 7. Salt. Salt is considered an important food item to avoid if you have fatty liver disease. Excessive salt intake contributes to fluid retention in the body, increasing the workload on the liver. This can be detrimental to individuals with fatty liver disease, as their livers may already be struggling to function correctly. Research has shown that high dietary salt intake can result in changes in liver function and structure, leading to inflammation, fibrosis, and liver damage. A study published in the journal PLOS1 found that high salt consumption in mice resulted in liver macrophage activation, leading to inflammation and fibrosis. Reducing salt intake is considered an essential dietary measure for individuals with fatty liver disease. A study published in the Journal of Gastroenterology and Hepatology found that a low-sodium diet improved liver function and reduced inflammation in individuals with non-alcoholic fatty liver disease. It's essential to be mindful of our salt intake even when preparing foods at home. Foods high in salt, such as processed snacks, canned soups, and condiments, should be avoided or limited. Limiting sodium intake to less than 5 grams per day can positively impact liver health and improve overall well-being. Number 8. Artificial sweeteners. Artificial sweeteners, the low-calorie alternative to sugar, can have adverse effects on liver health, particularly when it comes to fatty liver disease. Some studies suggest that artificial sweeteners may affect insulin sensitivity and glucose metabolism. In individuals with fatty liver disease, managing insulin levels is important, so monitoring the response to artificial sweeteners is advisable. Also, consuming these sweeteners can disrupt metabolic processes, leading to an increase in liver fat deposition. Furthermore, artificial sweeteners can alter the gut microbiota, which can play a critical role in liver health by promoting inflammation and liver fat accumulation. The decision to include or avoid artificial sweeteners in the diet of someone with fatty liver disease should be made on an individual basis, considering factors such as overall dietary habits, metabolic health, and personal preferences. Working with a healthcare provider or registered dietitian who can provide personalized guidance based on your specific needs and health goals is recommended. Additionally, focusing on a balanced diet rich in whole foods, fruits, vegetables, lean proteins, and healthy fats remains important for supporting liver health in individuals with fatty liver disease. Number 9. Fast food. Fast food is often tempting but detrimental to liver health, particularly if someone has fatty liver disease. Fast food is often high in calories, unhealthy fats, and sugar. The combination of these factors is responsible for metabolic abnormalities, including dysregulation of insulin and glucose metabolism. As a result, when individuals consume fast food, they're at risk of further damaging their liver as it causes inflammation and hepatic fat accumulation. Fast food contains excessive amounts of sodium, chemicals, and unhealthy fats that contribute significantly to heart disease, stroke, and obesity. Studies indicate that fatty liver disease increases when individuals consume fast food, and it leads to a more potent disease progression. Moreover, fast food increases the risk of insulin resistance and metabolic syndrome and becomes a crucial factor in developing non-alcoholic fatty liver disease, NAFLD. According to the American Journal of Clinical Nutrition, fast food consumption and poor dietary habits are the primary cause of NAFLD, affecting 1 in 3 Americans, a significant increase over the past 3 decades. The high-calorie intake of fast food leads to excessive amounts of fats that accumulate in the liver, causing inflammation, liver damage, and potentially leading to cirrhosis or liver cancer in severe cases. Individuals with fatty liver disease need to avoid fast food since it triggers the disease's progression and results in more severe complications in the long run. When managing fatty liver disease, it's important to focus on a healthy, balanced diet that supports liver health and helps reduce fat accumulation. That's why it is important to work with a healthcare professional or registered dietitian to develop a personalized diet plan that meets your specific needs and medical conditions. They can provide guidance on portion sizes, meal planning, and nutrient balance to help manage fatty liver disease effectively. If you found this video helpful, please give it a thumbs up. Thank you for watching, and for more amazing videos, subscribe to our channel.